Good afternoon. Welcome to the Arthritis Broadcast News. I'm Marilyn Muldoon. I am a person living with Sjogren's disease, and I'm here at the Whistler Conference of the CRA, and I have had the opportunity to get to know some pretty remarkable people here. One young lady I'd like to introduce you to today has not only been a wonderful assistant and aid and help here at the Arthritis Alliance booth, but is also living with a disease that I personally have known very, very little about. So I thought I would pick her brain and share a little bit about ankylosing spondylitis with you. I would like to introduce you to Madame or Mademoiselle? Madame Manon Roberge from La Belle Provence. Welcome to Whistler, Manon.
Merci.
I have really enjoyed having the opportunity to talk with you over the last couple of days. Now, in a nutshell, Manon, how would you explain ankylosing spondylitis to a layman?
It's an autoimmune disease. The immune system activates and attacks the articulations in the spine specifically, in the arch. What do you call it?
In the waist, in the hips?
In the hips.
Okay.
Most of us ankylosing spondylitis are located in the upper body, which is the one I have. And there's also the one I don't have, which attacks the peripheral articulation, arm, knees, and feet.
Oh, so it can be quite widespread if you...
Yeah, in the eyes and the lungs. Yes.
Okay. Now, what were your first signs and symptoms that there was a strange bit of mischief going on?
I was 16 years old. I had a sciatic nerve pinch.
Yes.
So low back pain and leg pain. That's how it started at 16 years old.
And did you investigate it?
No, I did not. I thought it was just normal or exercise or created by exercise. So no.
Was it at that point in your life, you're only 16,
Yeah.
was it at that point in your life interfering with quality of life or your ability to move about freely?
The quality of life, I would say no. I would just have difficulties walking sometimes because it was an on and off symptom. So that's pretty much it. I didn't have really huge limitation at that time.
So time goes by.
Yeah.
And what happens?
What happens is I'm waking up at night hurting, so I'm moving around the house to get a comfortable position. So I end up on the couch most of the time, and with the pressure of the back of the couch, I'm okay. So I fell asleep again.
Okay. But you're how old at this stage now?
I'm around 18.
18? So in 2 years, we've noticed more change.
Yeah.
Okay.
And so at that time, it's still hurting, so I went to the doctor. I went to the emergency, and they gave me a paper to do physiotherapy.
Okay.
I did that. I did a lot of sports too. It helps, so it went kind of a way, but nothing more than that.
So you went to physiotherapy,
Yes.
and nobody at physiotherapy was yet putting 2 and 2 together?
No.
All right. When do we finally find out that there was something serious going on here?
So in 2003, I went to see a chiropractor. He resolved my sciatic nerve pinch, but the back pain was still there. So I did 6 months treatment with him, but the back pain was still there, and no flag was raised by him either.
Okay, so we've got a physio and we've got a chiropractor not catching this, all right?
So after, I went to see another physiotherapist. Maybe 2 years after, I was about 26 years old. And I had lost a lot of mobility in my spine then.
Okay.
I did some treatment with him. He never raised the flag either. even with mobility that was already then restrained.
Was your posture shifting a lot
No,
by then?
no, at all.
Okay, all right.
So then came the willing to have a child. I was about 30 years old. I was 29 years old, and I wanted to know once and for all what was happening with me.
Right.
So I went to, I didn't have a GP, so I went to a private GP
Okay.
to know if I had cancer.
Okay, fair enough.
Yeah. So I went there, and he took measurements and made me bend down. So he made me have a blood test. And so I returned home with no diagnosis yet, but a call 2 weeks after that I had an appointment with a rheumatologist.
Okay.
Within 2 months I was diagnosed, finally at 30 years old, so 14 years after
14
everything
years.
first started.
Okay. So you're now what age? 26?
I'm
You're 30 at
30
this
years
stage.
old.
Oh, okay. The biological alarm clock is ringing.
Yeah.
Manon wants to become a maman.
Yeah.
And so you go to see the rheumatologist, and he explains, Manon, you have something called ankylosing spondylitis. How did you receive that news?
To me, that news was kind of relieving because I thought I had cancer.
Okay, yes.
So I took it was like a Scrabble word to me, really paying Scrabble word.
Right,
That's it.
right.
The only thing I had in mind is to have a baby.
The baby. So you broach this issue with the rheumatologist, say, okay, I've got this disease,
Yeah.
but I would really like to have a child.
Yeah.
What was his or her
He
response?
said yes.
He
So
said, "Go
I
ahead."
just did, and I had a little girl.
Oh, congratulations. But let's just back up a second. Before
Yes.
you had our little
Yes.
girl, what was the 3 trimesters of pregnancy? Were you in added pain with the weight coming to the front of the
No.
female body?
No.
It didn't bother your spine?
No.
Did you have, so you didn't require any extra medication?
No.
Or what medications do you take?
I take anti-inflammatory medication,
Oh, okay.
which was naproxen
Okay.
at the time, so I took that for
Right.
4 years. I try not to take it a lot during my pregnancy.
Right.
So, yeah, that's it.
Yeah. Did the rheumatologist want any extra blood work or whatnot done while you were pregnant?
No.
Is, I guess because there are different types of ankylosing, I guess there's a spectrum of it, is becoming pregnant or actual and safe delivery of a child, are they oftentimes jeopardized by this disease?
No, they're not.
They're
No.
not.
No.
Okay, that's good to know. That's
No.
grand to know. So you were able to have a regular delivery, or did you require a C-section?
I had a regular delivery.
Excellent.
The only thing that can relate to ankylosing spondylitis is the fact that I received a peridural. How do you call that?
Epidural,
Epidural.
right?
And the anesthetist had a really hard time making it work. So it
Yes.
took an hour and a half. I had a really patient anesthetist
I'm
who
glad.
worked hard on my back.
Yes, I imagined, I never thought about how that would compromise his ability to alleviate that pain for you, whatnot, to get it in the right location.
Yeah.
Yes, okay. And so the baby arrives, all is well.
Yep.
After pregnancy, did your spondylitis, did it worsen? Did it stay the same?
I think it's gotten worse.
Okay.
It's my posture is now. I have kyphosis, which I'm bent
Okay.
more in front. It's been worse since I had a baby,
Okay.
and I had pretty much my first big flare a year ago, which is 2 years after my delivery. So I think it activated a little bit the disease.
I was
more.
wondering, yes, yeah. Well,
For
having-
me, yeah.
Well, you know, having a newborn for any mother can be stressful. Our sleep is interrupted. We don't want to lose sleep when we've got autoimmune problems, you know. And just, you know, worrying about the infant, etc., it places a stress load on the new mom. And so I personally, I have a special interest in fertility and childbearing issues in the women suffering from autoimmune disease. With my disease, Sjogren's, we have some issues for if a woman is young enough when she develops her Sjogren's, her infant has to be monitored for several things. Well, I'm glad to hear that all worked out. What is the protocol now? What meds are you taking?
Right now, I'm supposed to start Remicade, which is a biologic medicament,
Right.
Medication, sorry, that reduces the activity of the immune system. So I hope it's going to help.
Okay.
Yeah.
Excellent.
The
And
damage has already been there. The damage is there because I have been diagnosed late.
Yes.
So
Yes.
trying to prevent
So,
some more damage.
like a lot of autoimmune diseases, I guess, the earlier the prognosis, the early the diagnosis rather, the earlier we can get cracking and try to minimize the damage.
Yeah.
Now I'm going to ask something as a person who you know, was totally ignorant about your disease prior to this conference. Many people might ask a question, and in as much as this is an autoimmune response, people might say, well, was this a lack of calcium? Was this something that was lacking in your diet as you were younger and growing that made the spine start to have difficulty?
No,
No, didn't think so.
at all.
But there it is. People might have wondered. So we've clarified that for you. So you're going to start the Remicade when you go back to Quebec, or?
Yes.
Okay.
Yes.
All
I'm a
right.
little scared to start it.
I know. There's always a little bit of apprehension when we
Yeah.
start these new things, but you have a support group there.
Yes.
Yes, you do. Are you the support chair in Quebec?
Yes.
You are? Okay. You've got a lot of people to work this through with, a lot
Yeah,
of support,
definitely.
and
Yes.
oh, that's excellent, that's excellent. Well, I hope you will keep us apprised of how you're doing, and I hope that we will see you at many other CRAs in the years to come, Manon. Merci bien.
Merci.
Vous êtes très gentille, mademoiselle. Madame.